In this video, I'm going to explain how long you can expect your recovery time to take when you've had the Tenex procedure, and then also what your rehab should look like. Because remember, even though Tenex is a surgical procedure, it doesn't actually fix the tendon and it doesn't make it stronger. It just takes the pain away. So you still have to do your rehab afterwards to strengthen your tendon back up to be able to do all the walking and the running or the jumping you may want to be doing. I've made a whole video about what the Tenex procedure is, how it affects your tendon, and all the risks involved with the Tenex procedure, as well as how you can avoid those risks. So have a look at the description of this video if you want to know more about that. For those of you who don't know me, my name is Marika. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment of any type of Achilles injury. Have a look at the description of this video if you want a link to our website. Now, quite soon after you've had the Tenex procedure, you may find that, things are actually feeling pretty good. But it can take between 6 to 8 weeks to get back to your full normal amount of walking you want to be doing. And for running sports or jumping sports, it can take about 12 to 16 weeks to get the full strength you need for those. Why so long? Just because it takes time to build strength. And even though you don't have pain at the moment, your pain may return if you don't strengthen your tendon properly. Now, of course, there are different things that can affect your recovery time. So the first is how strong your tendon was before you had the procedure. If your tendon was pretty strong, it was just the pain that was annoying and irritating it, then you may get back to your normal activities more quickly. If, however, your tendon wasn't that strong, then you may take a little bit longer to build the strength you need to do your full volume of walking and running you want to be doing. Also, it depends on your ultimate goal. If your goal is just to walk and walk your dog, you'll achieve that really quickly, compared to somebody who actually wants to run or hike up mountains or want to do a jumping sport. It will take longer to build that level of strength. Then also, your general health affects it. If you have a condition like diabetes, for instance, that will cause you to heal more slowly, and it takes longer for adaptations in the body to happen. And also, things like the menopause, where you have a drop in estrogen levels, that can affect your recovery time, because estrogen impacts how quickly your body can produce and strengthen collagen fibers, and collagen is the main building block for tendons. I'm going to discuss the rehab protocol in 4 stages, purely because during the first few weeks, it's week by week that you do new things, and then later on, it's several weeks at a time that you work on specific things. Now, please note, your doctor may follow a different protocol, and that is absolutely fine. And also, your doctor may want to review your tendon's progress before you actually move on to different stages. So don't just go and blindly follow this program. It's meant to just be a guide for you to know what you're going to be expecting, but you need to follow the advice of your doctor or your physical therapist that you're working with. Immediately after you've had the procedure, for that first week, you will very likely be placed in an orthopedic boot, and you'll be given some crutches, and you'll be told to walk with only partial weight bearing, so only putting some of your weight through your leg. And it's quite important to spend that time protecting the tendon and being nice to it. Now, you may find that you're quite uneven when you've got that boot, and it's really difficult to walk because your other leg is now too short for the one with the boot on. If that happens, it can really help to get it even up. It's just a piece of rubber soling that attaches to any type of shoe, and it can level things out a bit, that it's easier to walk with the crutches and everything. I've made a video about partial weight bearing walking with crutches before, and I'll put a link to that in the description of this video for you. I'll also put a link to the Level Up on Amazon if you want to have a look at that more closely. Now, with regards to exercises, you will likely be told that you can do gentle movements, and these involve just gently pulling your toes up, pointing them down, but not stretching it. You're just moving it in a comfortable range. We're not pushing into any pain, and just moving your foot side to side. Now, you may wonder, well, what's the use of that? That doesn't do too much. Well, it has a very important job. It helps improve your circulation and just keeps things going. And that's important because we know that as soon as your foot is in a boot, you have a slightly higher risk of getting things like blood clots, for instance. But if you do gentle movements throughout the day, then that can actually decrease that risk. And it just helps with improving the circulation in the tendon, and better circulation leads to better nutrients, more oxygen, and that all helps with healing. Now, with regards to how much can you walk partial weight bearing and doing your exercises, it's really important to check how your pain feels throughout the day. If you find that in the afternoon your foot is really painful, you've likely overdone it. But also something that's important is if your pain changes. So say for instance, it's been a bit uncomfortable on the tendon all this time, that's fine. But then all of a sudden your calf becomes quite swollen and really uncomfortable, or throbs or hot, but the pain increases significantly. Speak to your doctor, because those may be signs that you have a blood clot and that needs to be dealt with immediately. So if you're at all worried about the level of discomfort you're feeling, call the doctor's practice. It's always worth checking rather than delaying. As you enter the second week after your procedure, you'll be told that you can start removing the boot during the day and use your crutches less and less. Now, instead of removing the boot and immediately go walking in bare feet or in flat shoes, it can often be a good idea to actually transition to shoes that has a little bit of a heel on them, like your running shoes, or any shoe with a tiny bit of a heel on them. Or if you only have flat shoes, putting a slight heel wedge into those shoes can also be useful. And the reason for this is when your foot is flat on the floor, the Achilles tendon is a little bit closer to the insertion on the heel bone. And that can sometimes cause a lot more discomfort if the tendon is sensitive at that point. Whereas if you have a slight heel on it, you take the strain and the stretch off the tendon and it can be a lot more comfortable to walk around. So it's often a good idea to transition from the boot to a shoe with a bit of a heel on it, and then slowly make things lower as your tendon recovers. And usually often when you can get higher loads through it with rehab, that's the time that it starts to tolerate flatter shoes more often. As for exercises, you're not going to do anything exciting at this point. It remains just gentle up and down movements and side to side movements of the foot. Nothing more dramatic than that. Okay, so now we're entering the third part of your rehab, and it's kind of from week 3 up until week 6. So during this period, we want to build your walking endurance and we want to start strengthening the tendon properly to be able to tolerate all of these things. With regards to walking, you should be quite comfortable walking around the house at this point. It doesn't matter if you've got to wear your shoes to be comfortable, that also counts. So you can slowly start going out for longer walks and start walking for exercise, but you've got to be sensible about it. Whenever we introduce something new like walking to the program, you don't just want to start with half an hour walk. You want to think about, how much have I been walking? What's the longest walk I've done in the last couple of weeks? Well, the answer will be not much, because you've been stuck in the boot and then stuck around the house with crutches. So instead of going out bang for half an hour walk, maybe try a 10-minute walk first and get used to that. And once your tendon is absolutely happy with that, add 5 minutes or 10 minutes at a time to build up the endurance. Also, walk slowly. The faster you walk, the harder you've got to push off your with your foot and your Achilles tendon, and the more likely it can irritate it. So one of the mistakes I see walkers make is that they go immediately into speed walking because they're so happy to do that. But actually, that can really flare it up because it just overwhelms the tendon. It's not ready for it. So start with slow walks. Once you can comfortably walk for 30 minutes at a slow pace, you can slowly start to increase that pace until you get to be able to do it at a brisk pace. The choice of shoes are still important here. If you're going to try and walk long distances in flat shoes, it is much more likely to flare the tendon up at this point than if you wear running shoes or a shoe with a slight heel. So choose something that's comfortable for your foot, and only once you can do a good volume of walking in that, start doing shorter walks in flatter shoes if you want to move on to flatter shoes. You will also be given rehab exercises at this point, and the aim of the rehab exercises is to restore the strength in your calf and your Achilles tendon so that you can do all the activities you want to be doing without flaring it up. Your starting point will very much depend on your specific situation, because people vary in age, in fitness levels, what they've been able to do in the last few months. A good place to start is often with double leg heel raises, so that you start with low load things and just see how it reacts to it. But you will eventually be moved on to single leg work by your physio when they feel you're ready for it, and then even adding some weight to that. Now, I've made a whole video because this part of the rehab becomes very similar to normal rehab for Achilles tendonitis, and I've made a video about different choices of exercises to strengthen the tendon, which I'll link to in here. But always start with easier exercises than what you think you should. Just test one session, check the 24-hour response to those exercises, because remember, tendons often have a delayed pain response. If it's absolutely fine, you can increase the difficulty until you find a level that challenges you. But by the end of this period, you want to be able to do 3 sets of 15 repetitions on a single leg with your body weight. Then you know that you at least have the strength for walking and walking longer distances. But at this same time, you'll build up your walking distance as well. Other things that's important for this period is that you never push into pain. You always want to keep your pain levels to a very minimal level. If your session of rehab exercises causes your pain to flare significantly several hours later, and especially your tendon feels more sensitive the next day, it means your rehab's not pitched at the correct level for you. If you're a sports person, you definitely want to be doing exercises for the rest of your body as well. So for your glutes, for your hamstrings, all those muscles that help support the calf muscles in propelling you forwards. And you want to avoid at this point any running activities until you've built enough strength, as well as cutting and jumping maneuvers, things that requires a forceful push off. You first need to build that base strength level properly and then ease into these. So next, we'll look at the 4th phase and final phase. This phase is not really needed if you're just somebody who wants to walk your dog or be comfortable around the house. It may be enough to just stop at phase 3. But if you want to do any running or any running, jumping sports or high-level hiking, you may benefit from the exercises in level 4. Okay, so in this final phase, we want to build the strength you need for forceful movements and for lots of volume of activity. So it means we're going to add extra weight to your heel raises. You'll definitely be doing them single leg, or if you're doing them double leg with quite heavy weights. You want to be moving through the full range of motion, so you want to get to over the side of a step usually. If you're doing running or jumping sports, it will include plyometrics, so jumping and hopping exercises, but only once you've built proper high-level strength. Also, there's always a point where you reach a level of strength that your physio decides, okay, now you've got the strength that we can ease you back into a running plan. And that usually involves something like a run and walk plan to slowly build up your endurance and then get to where you can run continuously. And what's very important for people who play sports like football and soccer and anything where you change quick direction is once you're ready to go back to training, you need to ease back into that training slowly. What this means is, instead of just doing the full out training session because I've completed my rehab, you go and do the training but at 50% intensity. So you do change of direction drills really slowly. You do your sprints only at 50 or 60% intensity. And then week on week, you increase that intensity until you get to 100% effort. If you get back into 100% effort within the first week or 2, you will likely experience a flare-up of your tendon pain because you will just exceed what the tendon can do at the moment. So it's not the surgery's fault or the Tenex's fault, it's just that you increased your volume of activity too quickly. Brilliant, hope you found that useful. Now remember, if you need more help with an Achilles injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.